Good morning and welcome everyone. If I can just ask you to take your seats. I know it's very early for some of you. The committees have been going very late and a number of you have a number of other events to get to today. So I wanted to get us started, first of all, with a huge welcome and thank you for the support and interest in the 717 approach and alliance. This morning it's my pleasure to welcome you to the working breakfast for the 717 target and the newly established 717 alliance. Pandemic preparedness has a paradoxical quality. When it's successful, we just don't notice it. As a result, preparedness efforts frequently go unrecognized, even by those who benefit from them directly. We underestimate both the achievements and the challenges involved in preparing for the next epidemic and pandemics. When I talk to health authorities and experts in different countries, I hear a recurrent message. Most are very familiar with the recommended policy interventions to strengthen national health security. Many have invested significantly in developing capacities and action plans, but they are not getting the results that they need or hope for. We don't regularly capture the evidence about what makes our systems as a whole effective, and we don't sufficiently analyze the lessons or successes that they share with us. At the same time, we are often reluctant to acknowledge failures, let alone evaluate them publicly. But failures also carry valuable lessons. We need to better understand the factors that cause often well-conceived plans to yield less than satisfactory results. In Resolve to Save Lives, we believe that epidemics can be prevented. In particular, we believe that a major opportunity for strengthening preparedness lies in early detection and rapid response. There is a growing body of evidence that demonstrates the critical importance of early intervention in reducing morbidity and mortality, as well as mitigating the severe social and economic consequences many infectious disease outbreaks cause. The 717 target aims to promote early and effective action to contain disease outbreaks and other health threats before they spread. Using this very simple set of 3 metrics, the target sets performance standards for rapid outbreak detection, reporting to public health authorities, and the organisation of initial response activities. It's fairly simple. 7 days to detect a suspected public health threat, 1 day to notify that public health threat, and 7 days to start immediate response actions. The approach is based on some significant work already undertaken alongside other partners, including WHO, CDC, and the Gates Foundation. The timeless metrics have been tested over many years, and systems analysis and functional assessments are core parts of the IHR M&E framework. So let me highlight just a few elements of particular importance. First, the 717 approach is about problem solving and offering guidance in real time on how to improve performance at national and subnational levels. It does this by identifying the factors that enable or inhibit effective local outbreak detection and response, focusing on pinpointing gaps and bottlenecks that can facilitate rapid decision-making or remedial actions, as well as to help prioritize domestic and international funding allocations. Secondly, it really focuses on local contexts. As we know, outbreaks begin in communities. This doesn't mean, however, that knowledge obtained in one situation cannot be fed into a larger pool of experience and evidence. The 717 approach offers a simplified framework for rigorous evaluation so that information and knowledge obtained from one event can be transformed into evidence relevant for other events, as well as other disease outbreaks. Thirdly, 717 really focuses on the overall system. What can make a real difference in developing the capacity to assess our public health emergency systems in their totality, not in their siloed technical areas? We must also monitor how they perform and work together to enable early detection and response interventions in real-world conditions. Fourthly, the target emphasizes speed. Speed matters and timeliness is essential. How quickly a health security system responds can make the difference between an outbreak that is contained and one that spreads unchecked. Adopting a target can renew political resolves and help mobilize support for the achievement of performance objectives. It can also increase accountability and provide a focus for coordination and funding of priority activities. So today, we will also hear how the newly established 717 Alliance will be able to support countries to move towards implementing 717. I'm delighted to announce that the Alliance is headed by Dr. Isa Makumbi, who has done some remarkable work as in his capacity as Director of Public Health Emergencies Operations Centre in Uganda, and we will be hearing from him shortly. The Alliance will support countries in achieving the 717 target and help them meet their obligations under the international health regulations. It will offer technical assistance, financial support, and guidance to countries. And it will also act as a catalyst for ideas and learning and aim to improve our collective understanding of issues. A community of practice will enable exchanges between countries and with similar problems and with those who have gained practical knowledge and experience in how to address them. We must constantly challenge ourselves to explore new and proven approaches. Achieving the 717 target will involve working together to collect and disseminate practical knowledge that countries can apply to improve early detection and response in each of their unique contexts. We believe that the 717 approach can also play an important role in moving from individual examples of success to broader global progress. So I urge all of you here to contribute your ideas, your expertise and experience as we learn how 717 may make the world safer and prevent epidemics. So with that, I would welcome a short video and introduction from Dr. Makumbi before we get started.
The question we face about the next pandemic is not if, but when. We've seen what can happen when countries aren't prepared to prevent and stop epidemics. With COVID-19, nearly 7 million people have died. Its economic toll is over $16 trillion and counting. But it's not just COVID-19. When Ebola erupted in West Africa in 2013, more than 11,000 people died, and the toll was $53 billion. The impacts were life-altering to every single person caught in the virus's path. There's the farmer who lost his parents, the mother who lost a child, the child who lost their teacher. These lives could have been saved. Now we're shaping a new story that will change the future. It's a story built around when and puts us on guard for the next outbreak. This new story is shaped by 3 numbers: 717. 7 as in 7 days to detect a disease outbreak, 1 as in 1 day to notify public health authorities, and 7 days to complete early response actions. The 717 target for the quick detection and response to disease outbreaks works, and it can save lives. In India, Nipah was detected within 7 days thanks to healthcare professionals who received training on its symptoms and what to do when patients showed signs of infection. Authorities were notified of the outbreak within 1 day, and a plan of attack to contain Nipah was implemented within 7 days. The 717 target is a critical tool to making the world a safer place. Countries have already successfully added it to their preparedness plans. There's no time to waste. Speed matters. The 717 Alliance is a new country-led community to improve detection and response. Join the 717 Alliance. Let's work together to build systems to improve early detection and response. Let's work together now to stop outbreaks before they spread and prevent epidemics.
Dr. Isa Makumbi, I am honored to be welcoming you today in my capacity as the chair of the newly established 717 Alliance. We are going to hold a conversation on 717 Alliance that is facilitating the implementation of a new simple 717 metric for measuring timeliness and evaluation of public health system performance. Most countries have not yet fully complied with IHR 2005 provisions. In this regard, COVID-19 pandemic has demonstrated and revealed the need to improve the public health emergency system. 717 Alliance sets out to help countries meet their IHR obligation through adopting 717 targets: 7 days to detect the suspected disease outbreak, 1 day to notify the relevant public health authorities, 7 days to complete early response actions. Inevitably, as long as we live together with pathogens in the same environment, outbreaks and pandemic will continue to occur, but we can minimize the impact by making concrete improvements in our public health system and addressing critical identified gaps. Such improvements will contribute to countries' coping mechanism and make their health system resilient to absorb such shocks. There is now growing evidence that when early and effective action are taken, outbreaks can be contained before they spread or become pandemics. This point has been stressed and emphasized by a number of expert bodies, including the Independent IHR Review Committee and the Independent Panel for Pandemic Preparedness and Response. Today, it's critical that we align preparedness measurements and evaluation with operational capacity in the real world. And 717 has come in handy here. A number of countries now have adopted the use of the 717 metric to make improvement in their public health system. WHO Afro Regional Committee approved this metric last August, and Uganda has done too. 717 Alliance is established alongside the current reform or to reform IHR implementation, monitoring, and evaluation. We believe that 717 Alliance is both unique and essential to play a critical role in this space to address the real-world challenges in different contexts. The Alliance is dedicated to achieving early detection and control of public health threats. 717 Alliance approach is distinctive in offering a simplified method for evidence-based performance evaluation both at national and subnational level, as well as rapidly identifying bottlenecks and enabling factors influencing early effective detection and response. Talking about real world, in Uganda we analyzed the 48 public health events and we achieved the entire targets of 717 in some, but not all. We discovered that improvements are achievable during or needing a simple solution within our ability, like training. In the recent Ebola outbreak in Uganda, 717 helped in identifying in real time bottlenecks for immediate action and long-term bottlenecks for incorporating in our annual operational planning system for our national action plan for health security, helping us to make smart investment. 717 is supporting the country to strengthen IDSR implementation, promoting effective communication and accountability. What are we doing in the 717 Alliance? The Alliance now is creating partnership with the major stakeholders, including governments, public health research organization, multilateral civil society organization, and donors to drive this approach to improve performance. The Alliance offers technical, financial, and guidance to countries, and is also establishing communities of practice to benefit from common and collective learning to define solutions with shared challenges. There is a secretariat for the Alliance, initially funded by Resolve to Save Life, for further information. I now recommend to you and invite you to join the 717 Alliance so that we can work together to improve performance and drive us to fully comply with IHR 2005. I'm looking forward to future exchanges, to learning from each other, to sharing experiences on implementation of 717 targets, and advancing our health security together. Together we can. I thank you for your kind attention.
Just a huge thank you to Dr. Mukumbi, who couldn't be with us here today, but Uganda has really led the way in learning about 717 and have been very open to sharing their results, even at the peak of the latest Ebola crisis. So thank you so much to the Uganda team and Dr. Mukumbi. But with that, I'd like to invite our other partners up to the stage. So if you could join me here up on the panel, and I'll go through the introductions. The bios are, please, you can join me on stage. Thank you. and Timothy. Oh, thank you so much, Timothy. So the full bios, I'm not going to read through the esteemed achievements of all of our panelists. They're in the handout on your seats. But I'd like to welcome Dr. Timothy Musla, who's the Assistant Commissioner for Health Services at the Department of Health Sector Partners and Multi-Sectorial Coordination from the Ministry of Health in Uganda, who specialises in health policy and planning. Sadif Linz, who's the Director of Strategy from the International Association for National Public Health Institutes and works with national public health institutes around the world to strengthen systems. Dr. Afido Adifa, obviously the second Director General of the Nigeria CDC and who has been a key partner with Resolve for many years, implementing 717. And to welcome Dr. Monica Vleda, the Practice Manager for Global Health, Nutrition and Population Unit at the World Bank. So thank you so much for joining us. We know we only have a short amount of time to discuss. We want to hear from all of you today. It's been a very busy week. I'm surprised so many of us are still standing after the first 4 days of WHA with a few more days to go. But maybe I can start with Timothy from Uganda, really been implementing now for 14 or 15 months with a significant experience now in a real event with Uganda and a number of others. So can I ask how 717 targets supported improvement of health security in Uganda and your recent experience?
Yeah, thank you very much. Good morning, colleagues. In Uganda, we started implementing the 717 in 2021. So we've been doing it for a little over about 1.5 years. And it has really been useful for us to evaluate our performance and in detection and responding to outbreaks. First of all, we use it as a monitoring tool to evaluate our performance in terms of timeliness for decision-making, notification, and response. At the national level, when we receive any information about a suspected new outbreak, the 717 framework helps us to know whether the necessary early actions have been initiated immediately after an outbreak has been suspected. We've used it as a performance tool to analyze what we've done before, identify our weaknesses in our responses before, and make sure that within our national public health, response plans, we are able to respond faster moving forward. Of recent, of course, this was quite useful when we had the Sudan Ebola outbreak. Our response, of course, was rather delayed, and mainly because the suspected cases first went to the private sector, and we had not had a conversation that was optimized with the private sector to use 717. So it took us a bit of time. It took us about 46 days to just identify the outbreak. But at least within the subsequent 9 days, we were able to put in place the notification and response mechanisms. And we were lucky with our partners is that they were always ready to help us mobilize the resources to respond. And that taught us a lesson that, if 717, if we're not using the 717 metric, probably it would have taken us months. The previous Zaire, Ebola outbreak that we had, it took us over 100 days to just detect that. But 717, helped us, bring down the detection time, and I think that was quite useful for us. 717 has also helped us, recast and reprioritize within our national plan. What are the priorities? What works better? How do we rate our priorities within our response plans? It has really been useful, and because we use it when we are assessing performance, we meet weekly over these seats, and the first thing we do is to just look at the performance metrics using 717 and what it tells us. And then we keep on adjusting our priorities within our national plan based on what the performance shows us. And it's not only useful really within these very explosive outbreaks. We are able also to use it to detect, some MDR TB within our environment. In a very quick time, it took us 2 days to detect this, 1 day to put a response, and then by the 4th day, we had put these cases on treatment, which was quite fantastic for us. Thank you.
Thank you so much. So maybe I can move across to Nigeria, much bigger country, a federal republic, challenges in terms of national and state leadership playing an important role in epidemic prevention and response. It's one of the first countries we've started to think about 717 at the national and the subnational level. So could you perhaps reflect on the experience in Nigeria and the challenges of thinking about 717 throughout the health system?
Well, thank you very much. Excuse me. Yeah, so in the case of Nigeria, as you rightly described, there's a complexity of preparedness, emergency preparedness and response with shared responsibilities at national, states and sort of district level. I think to make a few points, one, what 717 has brought us has been elaborated on is, metrics against which to measure performance. So you've got a target to aim at, and we benefited substantially from the retrospective review, which had previously not been done, to identify sort of what performance looked like against the aspirations of 717. And this has been sort of adopted, and we're in process of making that a habit at national level. We are also piloting this in 3 states and the federal capital, and this is where, if you say this is where it becomes a bit more challenging. The NCDC in general, as a strategy, has recognized the importance of decentralizing what we do down to the subnational level. We will, of course, only be as strong as our weakest link, and it is very important that we get our subnationals to be on the same page with us regarding what their health security responsibilities are. And the 717 has been a bit revealing in making them understand how badly or how well they are doing, and basically what they need to aim for. And although it's early days yet, we now recognize that we actually need to roll out 717 across the entire country as something that is important for implementation of our action plan on health security. And actually, it's already been worked into the 2023 annual operation plans for our action plan on health security. So we continue to review the situation in the national surveillance meetings. The intention is that should really be replicated across all 36 states plus the federal capital. There's quite a bit of travel that we still have to do, but we will not be talking about travel or doing something if there wasn't something to aim at. And that, I think, is quite useful. So I'll give an example as I close. So we are dealing with a sort of diphtheria outbreak at the moment. Detection was really bad. Notification was somewhat delayed, but at least we were better at swinging into response. Now, other thing that 717 brings is, okay, so we talk about preparedness, and it's, a lot of it is the invisible stuff you do in strengthening primary health care, in preventive services like immunization, the stuff you want to do on UHC and all of that. And to an extent, the readiness part is ignored. Okay, if beautiful detection and all of that, but you are not in any, positioned to respond quickly, then that also is a problem. And the identified bottlenecks now give us sort of, the opportunities to intervene. We saw that we had challenges with resource mobilization for getting teams out of the door to respond, and now we've got, with support of Resolve, and others are now jumping on board. So we've got resources that are now sort of put aside strictly to help with deploying a team within 48 hours or less, should there be a need to do that. And the evidence of the need to continue that investment continues to be supported by data coming out of the 717 reviews, monitoring and evaluation.
Thanks so much. I mean, just to reflect, in the initial 60 or so events in the pilot countries, about 25% of the bottlenecks turned out to be people and process, not being able to move money quickly, not having fuel in cars, not having phone credit. And so it really spoke to those invisible pieces that make response happen. So as we think about building new NPHIs, maybe I can head to you, Sadib, as we really strengthen organizations, many of the NPHIs, especially on the continent, are young, are still developing. How does 717 play into that organizational development piece and supporting, understanding not just capacities, but capabilities to detect and respond?
Thank you, Amanda, and thank you to my colleagues for speaking so eloquently about the application of 717 in their countries. The principle of 717 is very simple, isn't it? It's about detect, notify, and act. So I think it's something that resonates with a lot of colleagues who work in the field as well, whichever sector they work in. So IAMFI, as the International Association for National Public Health Institutes, has 115 members over 98 countries. These are, as the name suggests, national public health institutes. So we have very senior leaders engaged within the association. The mission of IAMFI is to strengthen the roles and functions of national public health institutes, whether they sit as an independent organization linked to a Ministry of Health, or whether they are within a Ministry of Health as a public health department. And what value IAMFI brings is that communities of shared practice and learning. So we saw during COVID, there was a gap between what was happening in countries and then actually knowing about the decision-making processes that were having an impact on the response systems for COVID. And what we were able to do is bring countries together and bring senior leadership together to share lessons with each other. And I think some of the principles of 717 is exactly around that. It's about learning from each other across the systems. National Public Health Institutes sit very neatly at the interface and the intersection between health and non-health sectors. We know that we have to move towards an all-hazards approach. We have to understand where the health threats are actually coming from, whether that is within the health sector, whether that's within outside of it as an effect of climate change, for example. And what IAMFI does is to be able to share that knowledge, to be able to create the evidence so that countries learn from each other. And so I think, you know, with tools like 717, they can be really embedded within countries to help support that approach. And also the cascade then of that knowledge down across the systems can be supported. So that's where I think National Public Health Institutes really plays a strong role in that. Thank you, Amanda.
No, thank you. And so I think we've heard really that 717 is multiple different things. It helps us as a performance target and as a rapid quality improvement tool, strengthening organizational design and response. We've been using it to inform planning and prioritization, but none of that happens without the money. So with that, I'm going to turn to the bank. We've been collaborating with the bank for since the start of Resolve to really try to join planning and financing together. And the bank has shown very early interest in 717. We've been collaborating around the approach for several months now. So maybe I can turn to you, Monica, in terms of where you see this sitting for the bank and how it might be used within financing.
Great. So thank you so much and congratulations with the launch of the 717. I have to say I really like it, listening particularly to the countries, because I can see how it helps focus and sets a very clear standard and goal, which I think is incredibly important. I'm not an expert on PPR, so I'm going to talk about something I do know a little bit about, which is the health systems and financing. And in the World Bank model, we, of course, our priorities are very much driven by the priorities of the country. countries. And so, and the core of our financing in global health is around health systems. And so, to give you an idea of the total size of the funding of the World Bank in global health is around $34 billion. And these are all in health system projects in over 100 countries, around 230 projects in total. And we finance across the different functions of the system: public health, service delivery, so a lot of strong focus on community-based primary health care, and then the health financing reforms that are necessary to make the financing and the overall funding, including from domestic sources, sustainable over time. And I'm explaining this because there's here such a strong link between the PPR objectives and how the primary healthcare system needs to be ready to deliver that. And so we are going through a repositioning, and we're looking at our overall strategy in global health at the World Bank, and we're seeing two really large global challenges that is going to impact the way we will do our financing in the future. And one of them is climate. And so I'm really listening here, fascinated by the link between the increase in infectious disease and mini outbreaks and maybe larger outbreaks that we're seeing because of the increased temperature, increased humidity, and also really extreme weather events. I mean, we're all following what happened in Pakistan. If half of the country is flooded, you can imagine what that means in terms of risk. So that's one. And so we want all of our health system investment to go through a transformative shift and take into account the impacts of climate and make those changes that are necessary in the way that we finance the public health functions, the primary healthcare delivery, as well as the financing reforms on country. And then the second one is PPR. And there's this, I think you call it cycle of neglect and interest, or there's, right? And so we really want to ensure that now, we're sort of going post-COVID, and we see maybe that interest decline, that we keep a really, really strong focus on ensuring that whatever we do in terms of the investments in the frontline primary care, we have this in mind, the importance of pandemic preparedness. So that's my entry point. I'm really delighted to hear particularly the country stories and how much progress there is. And we look forward to a really strong collaboration from the bank's sort of comparative advantage, where we are really in need of collaboration is in that implementation piece, where really that important technical expertise and hands-on support in country comes in. And so that's the reason also why we work so closely with Resolve. Thank you.
Thanks so much, Monica. Maybe Timothy, I'd like to come back to you, because one of the challenges I've had in health security is explaining the complexity. Everything from deforestation up to machine learning and AI. After COVID, everything seems to be connected to pandemic preparedness. Trying to explain to non-health sector people what we're trying to do. How has 717 helped in Uganda in terms of that policy connection and that communication piece?
Yeah, thank you, Amanda. Now, I think the beauty about the 717 metric is its ease of understanding and simplicity. If you look at the frameworks we've been using, for example, if you look at the targets in the JEE, 19 of them, how do you communicate them to non-technically oriented policymakers, ministers of health, and people at the top? It was difficult, but the 717 metric is so simple, it's so straightforward, it's easy to communicate. So one of the biggest advantages that we've derived from the metric in Uganda is as a communication tool to other sectors and other ministries about what we are trying to do. And that has been effective for us. It has enabled us to convince the other sectors and to tell them that whatever investments you are doing are actually impacting on health and impacting on the way we respond to outbreaks. And that has been very useful. And my Minister of Health is always insisting that we live in a single health ecosystem around the globe. Much as we think about our health systems as a Swiss health system, Ugandan health system, Kenyan health system, Nigerian health system, my God, reality is not like that. It's a single bubble in which we live, meaning that whatever happens in Uganda will have a direct effect on what happens in the US. And the single most important benefit we have derived from the COVID outbreak, that it has enabled us as a global health community to identify what we are not doing well and be able to be ready for the next one. And we realize that the intervals between outbreaks are becoming shorter with time as we move ahead. And probably we are in an evolutionary cycle whereby life as we know it as human beings is probably coming to an evolutionary end at some point, because the outbreaks are just coming closer and closer. You move from one, you go to the other. When there is something, Marburg in Tanzania, in Uganda, Ebola is just leaving. We don't know when the next one will happen. But the fact that we can communicate this to our people in the best way possible, using a simple metric, has been fantastic for us. What it has not helped us do is, and we think that those who are thinking about, and perhaps AI will help us and the other things, is how do we have a framework that makes us better at prediction? Because all the data we have and the way we analyze it, as human beings, we are very poor at prediction. We simply cannot predict what is going to happen around the corner, especially in infectious diseases. And I think there's something that we can do. I don't know what it is, but we can improve our detection capacity, prediction capacity for these infectious diseases moving forward. It's for all of us public health specialists to think about.
Thanks so much. Dr. Tifa, I was going to ask you to help me because I'm a nurse by training and focused on simple things, but every time I present 717, the epidemiologists give me a bit of a hard time about the definitions, about whether it works for every disease. So as an esteemed epidemiologist working in Nigeria, how is it working for you across the different outbreaks that you're implementing, and how do you find the challenge of the definitions around, 717 being an achievable target?
Well, now I have the broken mic. Well, before I tackle your question, and just to take on also what my Ugandan colleague has said, I think we need to, in this cycle of neglect and interest and so on, the world, we're focused on this next sexy trend in public health or global health, and then we like to overtly complicate things because it's new and you want to. I think we should simplify the issue. So if you're talking about detection, and the definitions as you bring are in IDSR or in whatever country processes you have got. We've got suspect case definitions, we've got confirmed case or clinically confirmed case definitions, we've got laboratory confirmed case definitions. I think the simple things that we're not doing properly, the emphasis should be really to achieve universal coverage, for want of a better description, across the system, and then build on the slightly more complex things about that. So yes, we're all not doing well in terms of forecasting or prediction or even using the data you have generated historically to plot your next risk maps. And that's not really the complicated stuff you need AI to do. We're not even doing the basic stats and modeling properly because you either don't have the spare capacity to do that because you're chasing your tail, looking after often multiple and concurrent outbreaks. And the emphasis then working with in-country, with the IMFI and others, really is to do the work to strengthen MPHIs by getting all the human capital investments that they require to do this really unattractive background work that needs to be done to contribute to preparedness and, of course, even to pay attention to readiness. The other bit in terms of sort of, explaining this to people is, so health security is a big, all of government, multi-sectoral endeavor, and a lot of emphasis these days, especially in the aftermath, if we can say aftermath of the pandemic, is everybody is focused on the response, on how badly response went, and let's not talk about the politics that's jumped into that. But health security is, so where's the health promotion, the preventive service, the immunization, the primary health care, universal health care, the fact that people still have to, in a setting where health costs are driven by significant out-of-pocket expenditure, people who are ill are not going to present to primary or secondary level of care early, in which case you're going to miss the opportunity to detect whatever it is they're carrying. And even when they present early, you need to make sure that your surveillance system and laboratory systems are sufficiently decentralized and sensitive enough to pick up whatever it is you are interested in. And all of that is missed. And all of that really is part of curative medicine. It's not separate activity that needs to be put in place for national security or some parallel program. It is part of a standard functioning, resilient healthcare system. And I think using this metric to bolster the need for investment in all of that space is easy to communicate to people, I think, and people who have challenges with access to healthcare or not being able to get prescriptions or tests done will understand that, okay, to be able to detect, we need to drive all the investments in that space. So I hope in that long-winded manner I've managed to cover enough provide enough answers to the question that you asked. Yeah, thanks.
No, thank you so much. And I'm very aware that the best conversations happen over coffee, and so I want to make sure that we've got time to go back and have something to eat before another very long day. So maybe I can just wrap up by sharing the thinking that 717 is an additional tool in the toolbox to the other tools that we have. And the IHR framework and many other tools that we already use in countries really form the foundation of our understanding of where our systems are. And this isn't a silver bullet. As we've talked about, it's a simplification of a complex system that reacts not just to health systems and to communities, but to politics and policy changes. But we have learned over the last 14 or 15 months with Nigeria, Uganda, and several other countries that being able to explain where our challenges are, helping have a common language between animal health, environmental health, human health, with the finance sector, with other sectors in a way that's easy to communicate, is part of everyday work. To Uganda's point, every week they talk about 717 in their EOC, providing a common language of understanding where we are and addressing everyday outbreaks, not just preparing for the one that will come in the future, is helping countries understand where their challenges are, prioritize those, and take action in real time. So we look forward to supporting and learning with countries around how to best use real-time quality performance improvement like 717 to really understand where we are and where we can improve. And so I welcome everyone to share their lessons and to contribute to the thinking around the target and the approach. And I look forward to conversation next year and understanding where we are in terms of improving early detection and early response. So with that, I just want to thank our panelists and Dr. Mukumbi for his support, and I hope you enjoy the rest of the WHA and look forward to continuing the discussion.